Hello everyone. Now we will start the anti-tubercular drugs. Anti-tubercular drugs. Firstly, we'll do the first line drugs. And thus, the Ripe is now Rifampicin, Isoniazid, Pyrazinamide, Ethambutol, and Streptomycin. And second line drugs are fluoroquinolines, जिसमें ofloxacin and levofloxacin होता है. And the second line drugs, trick is pack, and it's para-aminosalicylic acid, PAS. It's given oral, and amikacin, capreomycin, and kanamycin. These are injectable. So first line drugs are rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. While the second line drugs are the fluoroquinolones, which are ofloxacin and levofloxacin, and further pack para-aminosalicylic acid, amikacin, capreomycin, and kanamycin, in which amikacin, capreomycin, and kanamycin are injectable, and PAS is oral, given oral. Now, the anti-tubercular drugs, alternative grouping given in KDT. So, group 1, which are first line oral drug, rifampicin, isoniazid, pyrazinamide, and ethambutol. Group 2, injectable drugs. So, streptomycin is given by injection, amikacin, capreomycin, and kanamycin. Now, the group 3, fluoroquinolones, which are ofloxacin and levofloxacin. Group 4, second line oral drugs are para-aminosalicylic acid. Okay, para-aminosalicylic acid. Now, the group 5, in which we are having unclear efficacy drugs like imipenem. So, mycobacteria. So, we are having these types of mycobacteria which are fast growing. And the ligation is on the wall, and intermittent growing, and these are known as perchers, very important. In this, the caseous necrosis is present, and slow growing, they are present intracellularly. So fast growing, intermittent growing, and slow growing. For fast growing, the treatment is H, means isoniazid, and intermittent growing, the treatment is R, which means rifampicin or rifampicin. Or slow growing, the treatment is Z, which means pyrazinamide. Now let's discuss the first line drugs of TB in the briefly. So firstly, these symbols are for isoniazid it is H, for rifampicin it is R, for pyrazinamide it is Z, and for ethambutol it is E, and for streptomycin it is S. So these are symbols. Now the we'll see the activity of the first line drugs. So HRZ are cidal, while HRZ and S are cidal, while E is static. So HR and E, in this the extracellular plus intracellular the bacteria are present, while the Z is intracellular and S is extracellular. And the most hepatotoxic is Z, pyrazinamide. And the E and S are not hepatotoxic, while H and R are hepatotoxic. Now pregnancy. So H and R, isoniazid and rifampicin are safe in pregnancy, while pyrazinamide is avoided in pregnancy, and ethambutol is also safe, but the streptomycin is contraindicated in pregnancy as it is autotoxic. Now isoniazid. Its symbol is H, or it's also called INH. It's a bactericidal and bactericidal and first line drugs for TB. It acts on extracellular as well as intracellular TB. So it is both extracellular and intracellular. So firstly, we'll see the INH or isoniazid. It's a prodrug. So in presence of CAT-G, catalase peroxidase, got converted into INH active. So isoniazid got active in presence of catalase peroxidase, which is CAT-G. So it further inhibits two genes, INHA and Cas-A gene. So the active isoniazid that inhibits two genes, INHA and Cas-A gene, which further inhibit mycolic acid synthesis. So it inhibits mycobacterial cell wall synthesis and produces bactericidal effect. So ये क्या करेगा, INH प्रोड्रग होता है जो कि कैटलेस पर ऑक्सीडेज या कैट जी की प्रेजेंस में एक्टिव हो जाता है. फर्दर वो इनहिबिट करेगा दो जीन्स को, INHA को और कैस ए को, जो कि फर्दर माइकोलिक एसिड की जो सिंथेसिस है उसको इनहिबिट करेंगे, जिसकी वजह से जो सेल वॉल सिंथेसिस हो जाएगी वो भी इनहिबिट हो जाएगी, एंड फर्दर दैट विल बी अ बैक्टीरियोसाइडल इफेक्ट. Now let's see the isoniazid resistance. So there will be the CAT gene mutation, Cas A gene mutation, or INHA gene overexpression. So CAT G gene mutation, Cas A gene mutation, and INHA gene overexpression is there. So here is overexpression. Now the CAT G gene mutation is most common and the most severe. So uses of isoniazid are: firstly, it is first line drug for TB. Second, it's not effective against Mycobacterium avium complex, MAC complex. So isoniazid is not effective against Mycobacterium avium complex. So let's see the side effects of isoniazid. So firstly, it causes the hallucinations, convulsions, euphoria, epilepsy, change in memory. Also anemia, gynecomastia, rashes, arthritis, and the most important side effects are peripheral neuropathy and hepatotoxic. So isoniazid is side effects are hepatotoxic and peripheral neuropathy, the most common one. So we can learn them by the name itself. So INH, I said it's a symbol of isoniazid. So I means isoniazid is, N means neuropathy, peripheral neuropathy, and H means hepatotoxic. So two side effects in the name itself. Isoniazid causes pyridoxine vitamin B6 deficiency resulting in peripheral neuropathy. So isoniazid क्या करता है, pyridoxine जिसको हम vitamin B6 कहते हैं उसकी deficiency, जिसकी वजह से peripheral neuropathy होती है. ठीक है. So pyridoxine is used for treatment and prophylaxis. That's why we give pyridoxine or vitamin B6 for treatment and prophylaxis. So for prophylaxis, vitamin B6 is given 10 milligram per day, and for treatment vitamin B6 is given 100 milligram per day. Now isoniazid metabolized by acetylations. Okay, now isoniazid is metabolized by N-acetyl transferase, which further become the acetyl isoniazid and formed in the acetyl hydrazine. So if there is isoniazid accumulation, means the person will be having peripheral neuropathy, while if there is acetyl hydrazine accumulation, the last product, so there will be hepatotoxicity. So the slow acetylators are having the peripheral neuropathy, while the fast acetylators are having hepatotoxicity. So rifampicin. So rifampicin is a bactericidal drug. Rifampicin should be given on empty stomach. Empty stomach देते हैं because of food interferes with absorption of rifampicin, because food interfere करता है absorption of rifampicin. That's why it should be given empty stomach. Now second, the rifampicin secreted in bile, so it is safe in renal failure. Third, it causes discoloration of secretions, very important. Orange colored urine and orange tears are present. So orange colored urines and orange tears. So that's why the orange tears, the staining of contact lens due to discoloration of tears. So mechanism of action of rifampicin is it interrupts RNA synthesis by binding to beta subunit of mycobacterial DNA dependent RNA polymerase encoded by RPO-B gene, which blocks the polymerizing function. Now fifth, rifampicin is enzyme inducer, so interactions are warfarin replaced with heparin, oral contraceptive pills replaced with other contraceptive method, and anti-HIV drugs got these rifampicin replaced with rifabutin. So uses of rifampicin are leprosy and brucella, which in this the drug of choice is rifampicin. In brucella we give doxycycline plus rifampicin. Now we'll come to the another drug, which is the pyrazinamide. So pyrazinamide is hepatotoxic. I said it's the most hepatotoxic drug. So it causes hyperuricemia, possesses the best sterilizing activity. Means it can kill slow growing bacteria. So treatment of tuberculosis is the drug sensitive TB in 2016 regimen. So type of patient new. We are having two phases: intensive phase and continuation phase. So intensive phase for new patient, we give 2 HRZE and CP 4 HRE, and in previously treated patient we give 2 HRZES plus. In this the 2 denotes months and 1 also denotes months. Okay, 2 HRZES plus 1 HRZE administered daily in intensive phase and 5 HRE in continuation phase daily given. Now the drug sensitive TB RT and TCP 2018. Now the category 1, in IP phase we give 2 HRZE and also in category 2 we give 2 HRZE, and in CP phase we give in category 4 HRE and category 2 4 HRE.